Now, as long as we're on the topic of race, remember Justice Ketanji Brown Jackson's dissent in that affirmative action case? She cited a study that purported to find black newborns have a better outcome with a black doctor. A brief filed by the Association of American Medical Colleges said, quote, "For high-risk black newborns, having a black physician is tantamount to a miracle drug. It more than doubles the likelihood that a baby will live. Yet due to the enduring and significant underrepresentation of minorities in the health professions, many minority patients will not receive care from a racially diverse team or from providers who are trained in a diverse environment," end of quote. And the study was widely covered.
There's new research from the University of Minnesota about black newborn babies. So the research shows that black newborns' in-hospital death rate is cut in half when black newborns are cared for by black physicians rather than white physicians. So joining us now live on Skype to talk more about her research is Dr. Rachel Hardiman with the U of M School of Public Health.
What we were really interested in studying with this particular analysis was the patient-physician relationship and if racial concordance, so having a provider, a physician that is the same racial identity as the newborn, if that mattered for health outcomes. Yeah, so we leveraged some really important data across, almost 20 years to look at nearly 2 million births and to understand what was going on here. And what we saw was that when a black infant, a black newborn had a black physician caring for them, the likelihood of infant death decreased significantly.
A new study finds black newborns are more likely to survive childbirth when they are cared for by black doctors. The study, published in the Proceedings of the National Academy of Sciences, reveals black babies are 3 times more likely than white babies to die in the hospital when they are being cared for by white doctors. While the research found there is little difference to the survival rate of a white newborn in connection to the race of the doctor. Dr. Jessica Shepard joins me now. She is an OBGYN at Baylor University Medical Center and women's health expert.
Now, we do know that this rate is significantly higher when we think of mortality rate in 100,000 deaths per year or live births. We see that may affect maybe 7 deaths per year, jumping up to 40 when we think of African American females and also infants. So that is strikingly different. Now, we know that the reason has a lot to do with structural racism, and also what we see in organizational healthcare is that we are not having the resources or also the alternative treatments for women.
So this study, of course, also went on to reveal that the infant mortality gap shrinks when infants are cared for by black doctors. Did this surprise you? And what does the reason for this seem to be? Why does it seem as though race plays a part in this, medical procedure?
That is something that reigns true in my heart as a Black OBGYN. One of the things is that representation really does matter. And so when you have these patients who have these paucities, depending on if it's financial, depending on if it's living in a food desert, or the access and resources to get them the adequate care that they need during their prenatal time, sometimes just seeing someone who looks like them, who might understand the difficulties and the struggles that they go through as a pregnant mom, these things do impact prenatal care, and also being able to listen to women when they speak, to listen to women when they have symptoms and when they have difficulties throughout their pregnancy, and how to guide them throughout that and make sure that they're being heard, but also getting the adequate care that they need.
Across the country, black babies are more than twice as likely to die than white babies. That's according to the CDC. Now, a new study has found the chance of survival nearly triples if a black baby is cared for by a black doctor. KCTV5's Casey Jones is looking into how the disparity may be playing out in our local maternity wards.
A new study published by the National Academy of Sciences pulled data from close to 2 million hospital births in Florida for over 2 decades. The study found that if black babies were cared for by black doctors, they were twice as likely to survive than if cared for by white doctors. Dr. Johnson explains shared race and culture can help doctors recognize subtle cues.
I know in the African American community, I pick up those things a little bit more often, and patients tell me that in their feedback that I do. That may be something that when you have a different ethnic background of the patient, that may be something that you're not able to see, and maybe it does translate over into the care for the infant.
So what can be done to ensure all babies get the same shot at survival? Tracy Russell, Executive Director of Nurture KC, says expanding Medicaid is a start because it allows better access to health care regardless of income. Russell also believes bias in medical professionals could play a role in disparities.
When you look at racism and how insidious it is, I think what we often lose track of is it's not just blatant displays, but it's that unconscious bias that's at play too.
So black doctors, when it comes to black newborns, are more caring, more insightful than white doctors, thus producing a better outcome for black newborns? By the way, do black doctors, when it comes to white newborns, care less and are less insightful than white doctors, giving white newborns care and therefore a worse outcome? Or are black doctors just better than white ones? But wait, the Daily Caller writes, quote, "But the study's methods have been called into question. A September 2024 replication effort concluded that the original study authors did not statistically control for very low birth weight newborns at the highest risk of dying. Applying that control zeroed out any statistically significant effect of racial concordance on infant mortality. Now evidence has emerged that the paper's lead author buried information in order to reach the conclusion." And in 2023, after the decision, the Heritage Foundation cited many flaws in the study and the way the study has been interpreted to demonstrate widespread systemic racism in medicine. The study does not claim to find a doubling in survival rates for black newborns who have a black attending doctor. Instead, in its most fully specified model, it reports that 99.6839% of black babies born with a black attending physician survived, compared with 99.5549% of black babies born with white attending physicians, a difference of 0.129%. Not exactly a doubling.
And the statistics are stunning. Black infants are more than twice as likely to die than white infants, a racial disparity that's wider today than in 1850, 15 years before the end of slavery.
Well, what I found in my reporting were really two things, both related to race. The first was that simply the experience of living in America as a black woman does something to your body that causes low birth weight babies, that causes maternal mortality, that causes infant mortality. Second is that there is a kind of racism in the healthcare system, and most of it unconscious. It's a kind of bias that's existed for a long time that we've known about that is affecting the birth experiences of black women in America. It can be everything from, I feel that I'm treated differently, people think I'm less intelligent, to I am being discriminated against by the police in housing and in my workplace. And those actually, it's been proven that those have a physical effect on the body, because every time you get stressed out in this way, and if it happens repeatedly, all of your systems fire up. And if your systems continually fire up, they break down. I think that what we have to do is change the medical system. Something is deeply embedded, a kind of I don't want to say individual people are racist. Maybe that is part of it, but this is something that's embedded in the system, it's baked in, and we have to, starting at medical school and before, to start getting doctors to face, and other medical providers to face unconscious bias that is affecting the care that women of color and everyone receives in the healthcare system.
The study does not control whether newborns are low weight, less than 2,500 grams, does not control for whether they are very low weight, less than 1,500 grams. Black babies are almost 3 times as likely as white newborns to weigh less than 1,500 grams.
For decades, black moms and infants have died at much higher rates, and now the state is taking steps to aggressively reduce this over the next few years. I-Team reporter Samantha Kummerer shares just how bad those disparities are and speaks to one woman who is working to change that.
Our moms are angry when they get here. They've called 20 doctors, they called 20 places, no one wants to take their insurance.
That insurance, Medicaid. Their moms, often Black, and facing far more obstacles to get prenatal care than white moms.
The outcomes at birth play a large factor on that patient receiving prenatal care.
The rate of Black babies dying is at a 4-year high. Nearly 13 out of every 1,000 Black babies born die in North Carolina, a rate 3 times higher than white babies and 2 times higher than Hispanic infants.
Unconscious bias is one reason. The Black women myths, Black women are prone to pain, so we can take more pain. Black women's skin, not in Black women, Black people in general, our skins are tougher, and the strong Black women, and all of those are just myths.
They stress it's still very safe for women to give birth, but the reasons behind the figures are complex.
Black women are 2 and 3 times as likely to deliver a baby that's a stillborn. They are more likely to deliver babies that are underweight.
Doctors assigned to treat very low-weight babies are more likely to be specialists rather than regular pediatricians or family practitioners. Black doctors are significantly less likely to be found in those specialized fields.
Right now, the infant mortality rate for Black babies is almost double the U.S. average. Even worse here locally. Knox County's health department is raising attention and showing us that statistic during the Black Maternal Health Week.
Adrienne Jones raises awareness on fetal and infant mortality. She says community access to fresh foods and affordable housing and even stress contribute to more Black women dying from pregnancy-related problems.
If a mom or a family doesn't have access to affordable housing, they're going to be stressed about that.
She says Black women at times don't ask for the help they need because of other factors like cultural biases in healthcare.
A lot of times women aren't being heard or seen or believed or treated when they're expressing pain or concern.
Black newborns are more likely to have severe issues that increase their risk of infant mortality, and those severe cases are more likely to have white attending physicians because white doctors are more prevalent in the specialized fields that treat those complications.
Black women in the U.S. are at a much higher risk of losing their babies, according to a new study. The report, Fighting at Birth, Eradicating the Black-White Infant Mortality Gap, finds the infant mortality rate for Black women is the highest of any ethnic group. Even factors like education, age, and socioeconomic status fail to impact the racial disparity. Keisha Bentley-Edwards is a co-author of that report. Can you explain why that infant mortality rates are highest for Black women? I mean, we do know that unfortunately about 24% of Black women in the U.S. live at the poverty line or below. But this isn't just about poverty, correct?
Correct. That poverty was what people pointed to, especially in the last, I'd say, 30 or 40 years, actually even longer than that, as a contributing factor for Black women having higher infant mortality rates. However, as we've had war on poverty initiatives as well as healthcare initiatives, these disparities, although the numbers, the infant mortality rates has decreased, the disparity has stayed the same, and for some groups is actually widened.
Why does the rate rise for Black women with higher education levels?
Yeah, it's amazing. I was actually surprised that it was that high. I knew that the disparity widened as education levels increase for Black women. And really that is a big part of the question. And once you take away age as a factor, you take away marital status as a factor, this gap still remains. And the one thing that you have to look at is racism, both interpersonal and structural racism, as a contributing factor.
The study's comparison of death rates for newborns who have doctors of different races does not take into account the fact that Black newborns have a greater likelihood of serious medical complications, and the attending physicians assigned to treat those more challenging cases are more likely to be white.
What's most devastating is that 60% of these deaths are preventable. And often when women, Black women, complain of pain or discomfort, it is not taken seriously, which is causing these deaths.
Dr. Neil Shah teaches reproductive biology at Harvard Medical School and is working to build more equity and trust in the healthcare system.
What people are dying of is not the clinical condition on the death certificate. It's a failure of communication and teamwork every time.
During Black History Month, we're looking into some alarming data when it comes to healthcare disparities among races.
Yeah, specifically, doctors saying that Black infants experience the highest rate of infant mortality compared to other races. But why is that? So Kennedy Walker, she joins us live in studio. You've been trying to find the answers to that.
Yes, good morning, Keith and Madison. Infant mortality remains a concern in the United States, but African-American babies have the greatest risk. Research shows that Black newborns are more than twice as likely to die in their first year compared to white newborns. They are also nearly 4 times more likely to die from complications related to low birth weight, and that's according to the Office of Minority Health. Now, common causes of infant mortality are premature birth, low birth weight, and sudden infant death syndrome, more commonly known as SIDS. And some infant deaths and stillbirths, they are caused by an increase in chronic health conditions among Black women before pregnancy, like type 2 diabetes and high blood pressure. But historically, and we've said this before, data trends surrounding Black maternal health outcomes, they are concerning. Black women have experienced higher rates of pregnancy complications, with them being 3 times more likely to die during pregnancy and childbirth than white women, regardless of income, education, or lifestyle. Experts credit this health disparity to structural and systemic racism, which can lead to chronic stress. And stress takes a toll on the body and could ignite biological changes in a woman that can affect her unborn baby's health.
We can't talk about infant mortality rate and racial disparities without talking about structural racism, social determinants of poor health outcomes, like where someone resides, lack of transportation, food insecurity.
This grassroots group comes with supplies and a message. One that's grim but important, and statistically more likely to affect these women. They are more at risk of having serious complications or dying after giving birth.
What we're trying to do is get the word out and educate everyone on Black maternal health, because Black mothers are uneducated about birth. It's surprising, but now I know that there are a lot of mothers that don't know.
It's about medical bias and discrimination. It's about pregnant Black women not feeling heard or seen.
While maternal deaths in America are still relatively rare, they are on the rise. In 2020, nearly 900 women were reported to have died from maternal causes, and in 2021, that increased by 40% to just over 1,200 deaths. But Black women are more likely to die than any other racial group, more than twice as likely than white women.
Mr. Speaker, today I rise to speak about the Black Maternal Health Momnibus.
It's a disparity that's been brought up on the national stage. The Momnibus is a multi-part bill introduced to Congress to improve maternal health, particularly among ethnic groups who are affected. Representative Lauren Underwood, who's a registered nurse, says it doesn't matter where you come from or how much money you have. Black mothers are still among the worst off.
We're seeing disparities even among people who have great healthcare coverage, got prenatal care, right? All these factors that would be protective for white moms are not protective for Black moms or Native American moms. And so at its core, we're talking about systemic racism within our healthcare system. And what we want people to know is not only do we have a maternal health crisis in the United States, but it is getting worse.
The study provides no convincing evidence on whether Black newborns with identical conditions would fare better, worse, or no differently with a Black or white doctor. Apart from that...
Oh, that's very different. Never mind.
This reminds me of the research supposedly proving systemic racism by a widely cited, fired former Florida State University criminology professor named Eric Stewart. The New York Post wrote, the academic was fired after almost 20 years of his data, including figures used in an explosive study which claimed the legacy of lynchings made whites perceive Blacks as criminals, and that the problem was worse among conservatives. These were found to be in question. College authorities said he was being fired for incompetence and false results. To date, 6 of Stewart's articles published in major academic journals like Criminology and Law and Society Review between 2003 and 2019 have been fully retracted after allegations the professor's data was fake or so badly flawed it should not have been published, end of quote. You see, when the demand for racism exceeds the supply, it becomes necessary to manufacture more racism. And if you have to manufacture or fabricate data to prove it, well, maybe, just maybe, things ain't so bad.
Why isn't your bank asking what's in your heart? When big banks cancel your account because they don't like your politics, or they share your transaction data with the government, it's no wonder they don't ask what's in your heart. That's not what they care about. Old Glory Bank is different. We're the pro-America online bank that protects your privacy, security, and liberty. Started by Dr. Ben Carson, Larry Elder, and John Rich, we proudly serve customers in all 50 states. Open your account in minutes at oldglorybank.com. We stand with you.
Just launched this week from the Elder Shop, new So Much for Climate Change shirt and hoodie, inspired by the irony we're all seeing, like Tesla's going up in flames. This gear says what everyone's thinking out loud and clear. Perfect for anyone who's had enough of the climate hysteria and wants to bring a little truth and a little humor to the conversation. Grab yours right now at LarryElderShop.com, and don't forget to use promo code ELDER25 for 25% off. Stand up, speak out, we've got a country to save.